Endometriosis is the growth of endometrial-like tissue inside of the pelvis or anywhere in your body. It is not defined as cancer because it does not replicate like cancer and it's not invasive like cancer. However, it can be very inflammatory and can be destructive.
It is a disorder that affects 1 in 10 women, ages 15 through the age of 44 years old.
There is not a known cause per se for endometriosis. However, we do understand and believe that there is a lot of genetic and hereditary predisposition for endometriosis.
I didn't even realize I had endometriosis. I struggled with irregular cycles and I ended up in the hospital because I was nervous about having a repeated cycle.
I was experiencing bloating and bleeding and cramping and major depression and anxiety. I was also experiencing constipation. I was also experiencing pain during sex. I was experiencing headaches.
So a lot of patients typically find out when nothing else makes sense. They've seen their primary care because their cycle was painful, and then they sent them to a gynecologist because they weren't sure what to do with that, and they focused maybe on the fact that their cycle was now heavy or abnormal. They went to the emergency room 2 weeks prior to that, and then the gynecologist will send them to a GI doctor because they'll say, oh, your rectum is really close to your uterus. Maybe it doesn't have anything to do with your uterus at all. All of your pain really sounds like it's GI related and you're constipated.
I went to see numerous naturopathic doctors. I went to see holistic doctors. I went to see therapists. I went to see psychiatrists. I was on countless medications to solve all these different issues, but never the primary one. When I got my hysterectomy, I was 41, and it's young. I don't have children. The fact that a disease is making a decision for me and my body did not sit well for me.
It can impact everyone, every facet of a woman's life. It can impact their significant other, it can impact their children, it can impact their social circle of friends and family.
All you want is an answer and to be heard and understood and to finally have a name to go with all the symptoms and the issues that I was having.
So I really needed to start paying attention to the food that I ate, making sure that the food was not causing me to be in pain, causing me to have flare-ups. I started doing more research online, started talking to people, joining community groups to have conversations with individuals about, what worked for them and how do they manage their pain. I sat in my pain to understand what type of pain I was dealing with so that when I did go to my medical professionals, I could describe the pain to them.
Patients need to know that shared decision-making is a thing. It should be the number one goal that you have when you go to any physician for any ailment and any disease process. Shared decision-making means you're having discussion, and it's a communal discussion of understanding and planning, and that your actual goals are taken into consideration in every move that you make with your doctor.
It takes a village. It takes a team of people to help patients with endometriosis because it's not just an illness that affects one area of your body or one part of your body. It affects all kinds of areas of your body. I mean, I have someone who helps me with my migraines. I have someone who helps me with my constipation. I have someone who helps me with vaginal dryness. Endometriosis is not a pretty disease.
I developed my own team. I have a therapist, I have an OBGYN, and I have a nutritionist. Even my eye doctor is somebody that I look at, and every medical professional that I see understands that I have endometriosis and that it could mess with any part of my body.
The individuals that may be part of the care team is probably vast. It could be their primary care doctor and their pain specialist. It should absolutely include, at the very least, their gynecologist. And then there absolutely is the option to bring in specialists like myself who do minimally invasive gynecological surgery and kind of have made it our business to specialize in the care of patients with endometriosis.
Some advice I would give a woman who may be going through this process of endometriosis is to extend yourself grace. This is a growing process. This is something new.
every single question that I had for a doctor prior to that visit, write it down. Write it down and go into that appointment with all of your questions, and do not leave until all your questions are answered.
You are not alone in this, that there is a community of women who understand what you're going through, can empathize with you with what you're going through, can be a resource for options or even just a listening ear. The communities are vast, and they're to be used as a resource